I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on CNN Philippines. As they say, Christmas is the best time of the year. But are you aware of the possible health concerns the season may bring? In a 2004 study, researchers found out an overall increase of 5% more heart-related deaths during the holiday season. This phenomenon is called Merry Christmas Coronary and Happy New Year Heart Attack. With a healthy diet, regular exercise, and constant visits to your doctor, you can still have a merry, happy, and healthy Christmas. How do we all enjoy the holiday treats without it taking a toll on our health? Find out the answers here on MedTalk. Joining us is Dr. Anthony Leachon. He's the president of the Philippine College of Physicians Foundation Incorporated and a cardiologist at the Manila Doctors Hospital. You can reach us through social media. Just use the hashtag CNNPHMedTalk and CNN Philippines. Good evening, Dr. Leachon.
Good evening, Angel.
Welcome to MedTalk.
Welcome.
Holiday heart syndrome. That's what the video expressed or shared, no? Merry Christmas Coronary and Happy New Year Heart Attack. You know, Christmas is supposed to be the happiest time of the year.
Right.
But it's also the time that we should take good care of our health, most especially our heart.
Exactly. Well, Christmas is definitely the merriest, but according to scientific evidence, it's also the deadliest time of the year. Mm-hmm. And there are many reasons why it's the deadliest. Mm-hmm. But yeah.
Doc, holiday heart syndrome and then the Merry Christmas Coronary and Happy New Year Heart Attack, are they one and the same, or do they fall under holiday heart syndrome? Do they fall under the category of holiday heart syndrome?
They're different, but they are interrelated.
Okay.
And I think we need to inform the public so that they can be healthy during the holiday season.
Mm-hmm. There's enough time for them to inform everybody how to be healthy. But first, before being healthy, we have to understand what is holiday heart syndrome.
Well, a holiday heart syndrome is a medical condition that is basically caused by too much ingestion or intake of alcohol in persons who are actually normal, without structural heart disease, usually young to middle-aged, and then suddenly would develop loss of consciousness, chest pain, and sometimes death. Mm-hmm. Now, in 1978, a scientist by the name Ettinger examined 32 cases and put them on Holter monitor, which is an ambulatory cardiac monitoring of the ECG, and showed irregular heartbeats, sometimes leading to death in patients who are actually ingesting or with heavy intake of alcohol during weekends or holiday season. And that's the term holiday heart syndrome.
Oh, okay. Is it common here in the country?
Yes,
it's diagnosed with it?
Yeah, it is common. So it's not usually during Christmas time or New Year's time, but it's common also during weekends or on certain times of the year when you have holidays.
Okay, so mas heightened lang siya pag Christmas kasi every day there's a reason to celebrate. There's a party.
Right, exactly. You know? And that leads us to the discussion on the Merry Christmas Coronary Heart Attack. Mm-hmm. Merry Christmas Coronary and Happy New Year Heart Attack Syndrome. So basically, in 1993, a doctor by the name of Robert Ploner made a study from 1993 to 2001 that there were 53 million deaths, and most of the deaths are actually related to heart attack and stroke. Mm-hmm. Right. So in that registry, they found out that people at that time, or even up to now, have an increased propensity to develop heart attack and stroke, starting from after slowly picking up December. And the most important date is December 25, and then December 26, and then December 31 and January 1. Mm-hmm. These are the 4 dates when you have the highest death rates related to heart attack and stroke. So the entire year, you can see the normal runs of heart attack. And then suddenly, they would pick up November 27, slowly picking up until you have a rabbit ear presentation from December 25, 26, slowly dip, but this one would be still higher than the previous months. And then they attributed it to a lot of factors. The first one was cold temperature, because during the holidays, we know na the weather can cause vasoconstriction, the cold temperature. But when they studied other places in the world during the holidays, the temperature is one of the other things, one of the other factor that can cause this. But it's actually overindulgence, the lack of sleep, the stress, the lack of exercise, even the absence of the doctors during the holiday season.
The doctors are also, you're also on holiday.
The doctors are holidays. So when you enter the emergency room, the most junior doctors would be facing the worst patients at the time when the doctors are on holiday. I mean, consultants. And usually, the laboratories or even the angiograms and all of these invasive procedures necessary for saving a patient would be closed as well. So the patients will forego checkups and then would actually reset this to after the holiday season.
Okay, so kunyari, so you're drinking and overeating during the holidays. Do you develop this medical condition over the holidays, or it can happen na kunyari you've eaten a lot and you drank a lot during a particular party? Can it happen during that party, or dapat mag-accumulate yung kinain mo at ininom mo?
Yeah, I think we should put this in perspective. The holiday heart syndrome can actually be happening in patients with normal heart.
Oh, okay.
But
no existing medical condition prior to that.
Yes, but the flurry and the I would say the long Christmas break or the holiday season is different from country to country, and the Philippines is predisposed to this one, right? So let's separate the holiday heart syndrome. But the most important one are those with increased risk factors that are actually prone to develop heart attack and stroke. So let me enumerate this so that the public will be informed. The first one is about the age of about 40. So usually male, but female also, depending on the risk factors. Patients who are smokers. Number 2, patients with high cholesterol, and high blood sugar or with diabetes, and that's the importance of laboratory exams being done before the holiday season. And then patients with hypertension, patients who are overweight or obese, patients with premature deaths in the family secondary to stroke or heart attack, and of course stress. So these are what we call risk factors. So therefore, this set of individuals should be alerted or warned that during the holiday season, they might develop heart attack or stroke, and they need to have some checkups.
Okay, so you mentioned checkup, no? It's also very important that during the holidays, we get our checkup also?
Yes, so basically, through the years of my, almost more than 2 decades of practice, I would say my advice to the patient is to see me November or early part of December, so that I can monitor their blood pressure, their weight, their cholesterol level, so that I can adjust their medications. There is no reason for me to decrease their medication or doses, because I know that the holiday season will be challenging for them, and therefore complacency is not evident in my discussion with the patient.
How about the symptoms, Dr. Lechon, of holiday heart syndrome?
Well, that 70% of patients with heart attack and stroke will not present with any premonitory signs or symptoms. So they can just drop dead. But, for the public, usually for heart attack, they can have increased frequency, intensity, and duration of chest pain, particularly in this area. We call it the substernal area, right? Radiating to the left side of your arm,
Okay.
and sometimes to the jaw because of the cardiac nerves also.
Okay.
And it is associated with easy fatigability, shortness of breath, and cold and clammy perspiration. Now, for the stroke, we have an acronym for that. So they can have this acronym, FAST. F, you have facial asymmetry, yung nangingiwi.
Okay.
Okay, A, meron kang arm weakness or even the lower extremity weakness. And then yung S, you have slurring of speech. And then T, time, they have to go to the hospital right away so that the doctors can reverse the condition. Because there's a golden time that the patient's condition can be reversed. Right.
So, doctor, we have to take a quick break. So, you mentioned FAST.
For the stroke?
For the stroke. Now, if you're at a party and someone is suffering from a stroke, what should you do? What's the first aid? We'll talk about that when MedTalk returns.
According to the World Health Organization, excessive alcohol intake kills more than 3 million people every year.
We're back here on MedTalk. Our topic tonight is Holiday Heart Syndrome, also Merry Christmas Coronary, and Happy New Year Heart Attack. We're giving information to all those who will enjoy the season of eating and drinking and eating some more, to take good care of their heart and to eat and drink in moderation, no, Doc? And plus, to also give them information on how we can help a friend or family member who might have a stroke during the holidays, and you know, on the way to the hospital or the emergency room. What should we do?
Okay. Basically, I have a checklist so that the public or even the patients. So I have two prescriptions. So I have one for the medicines and have a preventive health checklist.
Okay.
All right. So in the medicines, it's easy because you can just buy it at the pharmacy. But the hardest part is the preventive side. So smoking, number one is smoking is the number one risk factor because it can cause vasoconstriction, it can increase your blood pressure, it can cause heart attack because of the narrowing of the arteries here, and also stroke. Number two is diet. The WHO advisory about red meat and pork and beef that can cause colorectal and stomach cancer. It can also increase hypertension because of the salt preservative, right? And then number three, exercise. Because of the holiday season, we tend to forget how to exercise. So usually 30 minutes a day, just walking is very important. And then you have to take a look at your weight every now and then, because people tend to increase their weight during the holidays, mga 4 pounds. So, mga 1 to 2 pounds per week ang nag-gain. So, patients can actually gain mga 4 to 8 pounds during December, during the holidays.
What's the recommended, how do you call that? Ideal body weight or ideal number of pounds that you should gain during the holidays? Kasi 8 is excess already. 4 is even excess.
Right. You should not actually gain weight during the holidays.
That's quite difficult.
Right. But, you know, the usual nga, 1 pound per week because of the holiday season. We can tolerate that. But in patients who are overweight to start with during the holidays, that's a problem. So my suggestion is for them to watch their weight during the holidays.
Okay. I'd like to go back lang a little bit, Doc, to the first aid. If someone is suffering from a stroke. You mentioned FAST earlier, the symptoms that one might be suffering from. What should we do?
The first thing is after developing facial asymmetry, arm weakness, and then slurring speech is to go to the hospital, because there's nothing much you can really do. Because as a layman, you cannot do these interventional measures. All right, but you can have your emergency medications if the doctors advised them in the past. But the best way is to bring the patient to the hospital. With the traffic, they should be anticipating yung delay going to the emergency room. So that's the first one. Even with chest pain, they need an ECG, of course, and they're not doctors. And you know, these are sudden, so therefore they need to act quickly. Doctors, acting quickly, we should also act quickly and be more aware of how to pace ourselves when we eat, because
the spread of goodies and yummies during the holidays are really hard to resist.
Yeah. So I have a guide, the Healthy Food Plate. I got this from Harvard School of Public Health, and perhaps we can display this infographic. So basically, you have to divide the plate into 4.
Okay.
Okay, and then on one side, you have the grains there, no more than 1 cup. So if you're going to take rice, no more bread or pasta. So you have to choose lang whether rice ka, pasta, or bread.
Okay.
Kung bread, better ang brown bread or the wheat bread. And then if you have to choose, let's say for protein, ang recommended would be fish and chicken. Less of the processed food. We know hamon, maraming maalat during the holidays, so be careful about it. And then in one corner, which is the third item, vegetables, very important, and then fruits. And then less soda, of course, water, because 1 can of soda will give you 150 calories, equivalent to 1 cup of rice, and also 10 teaspoons of sugar, when the recommended one is only 1 teaspoon per day.
Okay.
Right.
Okay.
So that's my guide for the holidays. So the easiest guide is to have plenty of vegetables on your plate, just in case you'll be encountering, you know, a lot of buffets during the holiday, mga handaan, you know. And then pace yourself. Then if there's really a lot of parties talaga, you need to exercise as well.
Okay, walking is okay,
Walking
no?
is okay. You have to burn it as well. Though you have home exercises with you, I'm sure you can do something about it.
Okay, so we've talked about the food and how to control. How about alcohol and caffeine? Sometimes, you know, merrymaking includes really drinking.
Very good, very good. Because during the holidays, mahaba ang gabi, right? So to stay awake para parties, you know, kids will drink coffee, may iced tea pa, and then sometimes may energy drink pa for those who are working at nights, di ba?
Yes.
Right. And then sometimes may merrymaking sa alcohol. This combination can actually cause some problems. So sa akin, in moderation, 1 to 2 beers
per party
or whiskey. But if you're going to drink, do not drive, because we see also a lot of vehicular accidents during the holiday season. Right. So therefore your reflexes may be slower, and therefore you can actually cause some problem. And then also walking, sometimes yung imbalance, and they can cause brain injuries. We call it subdural hematomas.
Okay.
Sometimes nagkakaroon sila ng bumps sa head, and therefore can actually be a problem in the future.
Is there a certain type of medication you should take? For example, you know that you have a family history already of a heart problem. Should you take a certain medication prior to enjoying all these parties?
Well, you have to take your maintenance medication.
Okay.
So that is basically in my checklist. One of the most important things is that if you're going to eat a lot, then you have to maintain your medications. Some patients kasi would not maintain their medications or take their medications when they're drinking. O sabi na baka magkaroon na interaction. No, you have to take that, you know, and it is part of your routine.
Okay, that's an important thing. That's an important part of your checklist. Dr. Leachon, any other final message to all our viewers who will be enjoying the holidays and who would like to eat, be merry, and eat some more?
I don't want to be a killjoy, but you know, you don't want to spend the holidays in the hospital. You can be merry, but you can be healthy. So therefore, the best thing that we should do is to be informed. Because if we are not informed and empowered, then we cannot take care of ourselves very well.
Okay.
Tandaan natin, health is wealth, ang kalusugan ay kayamanan. And when you lose a loved one during the holiday, that's the saddest part. But then again, be happy, be merry, and it's Christmas. Merry Christmas.
Merry Christmas. It's time to celebrate.
Right.
Eat in moderation, drink in moderation, and enjoy excessively. Maraming salamat, Dr. Leachon.
Thank you very much.
We would like to thank again Dr. Leachon for helping us understand more about holiday heart syndrome, Merry Christmas coronary, and Happy New Year heart attack. We'll see you again next Thursday, 9:30 p.m. here on MedTalk, your scheduled on-air health consultation on CNN Philippines. This is Angel Jacob. Thank you for watching.